have reached another episode of Mother's War on Violence. You are listening to 89.9 FM, WCBU, and I am your host, Yolanda Wallace. And I hope everybody is doing well this morning. We are having another speaker in our studio today, and our topic will be about African American health. And I will let her introduce herself.
Good morning. My name is Francesca Armmer, and thank you, Yolanda, for an opportunity for us to have this discussion. I am a retired faculty member from Bradley University, and I currently serve as president of the Peoria City County Board of Health. I am excited about us having this conversation in terms of African Americans and health, especially because we are at the beginning of a new year, 2023, and it's a good time for us to re-explore and then to make some commitments and perhaps even, I don't want to call them resolutions, but some decisions for change that we can each implement in terms of improving our health.
Great. What are some of those changes?
Well, one of the things we know in terms of data and what affects African Americans, especially both nationally as well as locally, is that there are certain conditions that but actually are manifested in African Americans that are higher than what is represented in the general or in our Caucasian population. I just want to mention just a few of those, most of which I think we're already fairly familiar with. For example, we understand and know the incidence of heart disease, the incidence of high blood pressure, we call it hypertension, but high blood pressure, the incidence of obesity, diabetes, cancer, as well as even asthma and stroke. So when we're looking at how that incidence manifests itself in the general population, most of us have experienced or know a loved one who has or is dealing with some of these problems. The challenge becomes how we handle it, and I think that's where we can get into some discussions about what are you doing to either manage the challenges, what are you doing to encourage loved ones and friends in their management of the challenges, and what about the challenges of actually getting into our healthcare system and being faced with treatments and ways that you are responded to that sometimes shut us down from getting the information we need to make those wise decisions in terms of our own health care and the health care of our friends and loved ones. So I've gone the long way around to say part of what I think we really need to talk about is to discuss that whole notion of yours and my personal health advocacy. What we can do to advocate for ourselves, and then what we can do to be resource advocates for our friends and family.
Awesome. One of the things that comes to mind when you talk about advocacy is that I really like that right now they have telehealth, that you can go in and actually update your medications. And those that are old or you no longer use, you can take them off, because sometimes if you leave them all on there, if the doctor prescribes something, we don't know if there could be a conflict of medication or what. And advocacy, like you said, is a big word, and you advocate for yourself. So in terms of what other means of advocacy are you talking about as far as self?
I think that what you have said, Yolanda, in terms of that telehealth dimension is a valuable dimension. One of the things that we find out is that there are certain age groups for which telehealth becomes a very foreign and almost scary experience. And that's where we can, with one another, just encourage that kind of participation. I like to center advocacy in and around all those ways that we communicate.
Okay.
I know so many individuals who, once they are in the physician's office or when they're in an acute care setting, they forget the questions they wanted to ask, or they feel like that someone is being rushed and they're rushing and they can't get the questions asked. And I want to begin by saying no, that there is no such thing as a dumb question. If there is something on your mind, if you've heard a rumor, if you've even heard a myth in terms of a particular condition or a treatment that you're about to experience, and you want to ask about it, ask. There is no such thing as a dumb question. And for those of us who are healthcare providers, what we need to do, and I believe that there's some wonderful ones who do this already, is slow down enough to welcome the questioning. And as we welcome the questioning, if we have to say it 2 or 3 different ways until it is fully understood, then that's our role and that's part of our responsibility. Communication is important. It really is. It really is.
So you mean there's also the challenge in self-advocacy for ourselves in the different age levels, as far as
absolutely,
the younger, the elderly, the Gen Ed,
absolutely. And you know what? And without trying to itemize how things may vary, we can speak to the commonality of understanding.
Yes.
What it takes for you or for me to understand, number one, just what is happening with this whole thing called health. And I'll give you an example. What we know and how we cared for individuals who were diagnosed with diabetes, and we sometimes would say high, sugar,
high blood pressure,
and high blood pressure. What we know that was being done 30 or 40 or even 15 years ago has changed.
It has.
And so some of the things that some of us saw our aunties and our grandparents go through, and in treatments for cancer therapy, what we saw them go through then is different now. And we need to be able to ask those questions so that we can make that informed decision, and we can have the confidence to know that we know as much as we can possibly know now in making that informed choice. So that the whole idea of how we communicate with the different age groups really does make a difference. And so many times we use that phrase, one size fits all. No, it doesn't.
No, it doesn't.
It does not.
It
and
does
so
not.
what worked with an individual on Tuesday, that different person who may look like the one before, have the same as the one before, but that individual is unique and needs to be addressed with the respect and compassion of their uniqueness.
That's right. I was just thinking in mind as you were talking about the many athletes who are young that's just passing out, and unfortunately I've seen that majority of those have been African American young men, and I don't know if there was something that was going on prior to their cardiac arrest, or the thing that caused their ending of their transitioning of their life, but there maybe there was something that maybe he was having chest pains before, maybe this was happening or that was happening, and we should say something, speak up, like you said, ask questions, go to the doctor, get these things checked out, because it could detour us from having a much greater, seriouser situation. It could have been a prevention.
That's such a good point. And what we know about each of us in our own uniqueness is that there are what we would call modifiable risks and non-modifiable risks. That just means that there's some things in our lifestyles that we can do to change, enhance, provide preventive health measures. And there's some things, quite frankly, that we cannot. And that is why it is so important that we have that regular screening so that we can look at, and the physician and the nurse practitioner and that team of care providers can look at a full profile of us. There are some things that are genetically not modifiable, but because of science and our progression there, we can at least identify them. And if I know that there is a likelihood of me developing a certain type of breast cancer based upon my genetic profile, then I can make some informed decisions in terms of whether I will or will not move in a different path in terms of my care. So that's what I mean by non-modifiable. The modifiable pieces are the things that we really can do something about. Let me give an example. We cannot prevent breast cancer, but we can assess it through screening. We can early detect it, and then we can move through challenges and treatments to address it. And the reason why I mention that is breast cancer is one of those conditions that we know African American women, this is interesting, African American women die more of it than our Caucasian counterparts. We do not get breast cancer more than our Caucasian counterparts. We die proportionately more from it. And that's because of when we are diagnosed with the condition. And that sends us right back to when and why we are not being screened. Screening mammograms.
Right. So you mean by the time they find out about it, it's too late?
I don't want to say too late, but yes, we are into some staging that might be especially challenging. Oh,
so if we had been more proactive and went and got mammograms, the women's lifestyle, they have mammograms. I like the Unity Point mammogram mobile that they have out, and OSF have some things around town. And I guess that, when you think about it and you look at so there's research and studies that have shown that African American women pretty much, maybe if they had known ahead of time of things that they can control, not those other things that are genetic, but those things that they could control by getting the mammogram. And even if you have those that are genetic in your family, you still need to go and get screened, because sometimes, we think, oh, I'm going to save a penny here and a pinch there. And, and maybe that's not too important. Let's put it back on the shelf for a later day. But if we go and get preventative stuff, done with our bodies and stuff, we should be better. And I've also learned that breast cancer isn't just for women.
No, you're absolutely right. We don't spend as much time talking about the challenges of breast cancer with men, but you're absolutely right. It does. The incidence is there also. I want to mention one other thing, because what you're saying just kind of sparked my mind.
Okay.
Many times for us, especially African American women, but I will say for the individuals that I see so much, we are so busy caring for other people that we don't take the time to care for ourselves. We really need to recognize when we're talking about preventive care, when we're talking about healthcare measures, we can begin by taking care of ourselves, because that shows and gives an example of optimal health, and it also strengthens you. It's how can you encourage someone to do something that you won't do? How can we encourage individuals that you really do need a certain amount of rest, sleep? You really do need to make decisions in terms of drinking water instead of carbonated beverages that are sugar saturated. We need to be able to take care of ourselves, and in taking care of ourselves, become that informal role model for the individuals around us. It's like the message we send is a message both verbally and non-verbally. So I really did want to at least mention, because you had talked about what kinds of things we can do, and I really want to just center on a couple of things that everybody already knows. And I'm not talking about making a resolution or anything like that. I'm just talking about a consideration. Water. plan on getting adequate amounts of water. Now, that's not necessarily going to say instead of your favorite beverages, but it does mean, what if you set a priority set that says, before I will drink a particular beverage, soda or whatever, I'm going to get at least 4 8-ounce glasses of water in. And then after I've done that, then if I choose to, and I'm not setting 4 as a standard, I'm setting 4 as just a number to begin with, because we have to begin somewhere. They've given us the guidelines that say, because you're in the new year, do not go to the gym and decide that you're just going to be that weekend warrior that breaks your neck and makes every bone in your body ache and things like that. But I'm suggesting start. I'm suggesting just begin to make a commitment to be better in 2023, to be healthier in one particular area, and then as you master or continue to master that, will add to the area. So just one thing like that. I've already mentioned sleep, and we are underestimating, maybe because of all of the things we've got on our schedules, the value of rest, the value of sleep. Please consider getting a good 7, 8, 9 hours of sleep. And let's recognize that as we got older, the things that you could do on less sleep when you were 20, you cannot effectively do now that you are 40 or 50 or 70. Plan to give yourself sleep.
That's right. As well as, I like to add to that, take out time for yourself.
This is so wonderful.
Taking out time for yourself. I think about in our stressful world and everything that's going on, it's kind of hard to continuing, because there's a lot of caregiving and stuff going on right now. There's a lot of things going on with kids and stuff like that, and it is stressful sometimes. The prices are going up, and gas and things like that. And I have found that it is very good sometimes to just take a few minutes of meditation.
Yolanda,
and I meditate on God's word, but
amen. That is just so wonderful. Nowadays, and it's not current, but it's becoming more popular. What we do refer to that as mindfulness. That is when we're talking about, and some people have defined it as, mindfulness can be that moment-to-moment awareness of your experiences without judgment. You promote certain practices that can care for you, for whether it is exercise, whether it is listening to music and a type of music,
that's very
prayer,
soothing.
meditation, mindfulness, taking care
of you. That is awesome. That's something that we all need in terms of thinking about how to manage this stress.
Absolutely. Absolutely. I think it's really interesting when individuals say, it's just stress.
Yeah.
That almost seems to want to minimize the impact that stress can have on both our physical as well as our emotional and psychological being. Another thing that we're finding out, and I think that it's worth considering in terms of us as African Americans, we need to recognize that some of the conditions that normally seemed to appear in our lives at older ages are manifesting themselves in our younger people. We have, and I just was reading an article about an individual who was diagnosed with cardiovascular heart types of problems, and he's 23 years old.
Wow.
And so what we're doing, and we're beginning to look at, is that manifestation of that full lifestyle, however we've decided to jam-pack it together, and how it seems to be combined with stress, resulting in pathologies that we never thought a 20-year-old, an 11-year-old, a 12-year-old would be experiencing. again, all the more reason for us to practice optimal healthcare measures and let our young people see them, and let our adults reflect it in our lives. Because the pathologies, some of the problems are again showing themselves in our younger African American boys and girls.
They are. That's so true. Just like the health department talked about the fatality rate of our African Americans are, in death are just way much higher than our other populations here in Peoria. And I know that has a big contribution to that, just because we are not taking care of ourselves as much, and we just kind of run down, I guess. And bad habits, bad forming habits seem to contribute to that, like going to bed after I eat, you know what I'm saying? So I could stay up for a while, use myself as an example, and I could take a walk around the block, or two, just to help my cardiovascular, to help my muscles, to help with my arthritis, to help with aging, and if I was a younger person, just to keep in shape, to keep my mind sharp. When I walk and stuff, my mind is sharp in school. My mind is sharp when I'm, just interacting with other people. When I have breakfast, just, simple things like that. And implementing into my diet instead of sleeping all day, because I have, I'm off for the day. I just get up early and, get my coffee and my breakfast and get the day going.
Healthy practices. And it's not the kind of thing that we have to say that as of tomorrow I'm doing this, but it's a step by step. It's a gradual kind of integrating into your lifestyle. If it becomes an external, then it's easier for us to drop the externals. If it becomes a part of you and what you would want to do and how you want to see yourself, then we don't drop it. Why? Because it's part of what I've been doing. And we also build it into, and we reserve and we keep that time precious, that we are able to spend some time alone, spend some time meditating, spend some time in prayer, spend some time exercising to take care of ourselves. I like to say this sometime, when we're talking about modifying how you prepare foods or modifying even the types of foods you eat, most individuals, we have to recognize you were not born genetically not liking certain things. You really were not. If you were born,
veggies?
Green vegetables, like, oh no, I don't like that, or little Johnny, he just doesn't eat green beans.
He wants to have McDonald's and fries.
Hey, that's what he wants, and that's what I'm going to give him. Look, understand this. It's a learned behavior.
Okay.
You can learn to like greens, and we have, and many of us have learned it's a wonderful cooking experience when you prepare them, and you're preparing them with turkey, and you're preparing them with or you're making a new quiche with turkey sausage instead of pork.
Yeah.
There are ways that, and it is flavorful. It is not a burden. It's a learned behavior. We've got to be ready to teach ourselves. Why? Because you are important. And because you have a contribution to make in this world with your family and friends, and we need to make those kinds of decisions.
And adjustments to our lifestyle.
Absolutely.
When you think about the younger children who are in school right now and the things that they're, have changed and things since I've been in school. They have PE and stuff now, but there was coming be a time where the playgrounds were starting to disappear. But I'm glad that back in Peoria they have come back, and it's starting to be a part of the the curriculum, just to have exercise, because all this starts, like you said earlier. When you're a kid. And what you process as a kid is what you're going to do when you get older, a lot of us. And so that's a very important thing to consider. And then when thinking about African American women, sometimes the African American woman, she doesn't eat when she feeds the kids first.
Right. Oh, absolutely. Absolutely.
And
Absolutely.
becomes fatigue, and all that is related to self-neglect, right?
Yes, and you know what? I think you kind of went strong when you said self-neglect, but you know what? Maybe that's what we need. Maybe we need to go strong and say,
Yeah.
you know what? You really are valuable,
Yeah.
and you really are important to our families
Mm-hmm.
and to our friends. And because you're valuable, don't neglect yourself.
Mm-hmm.
Putting yourself as a priority is not an error. It is a way of saying, I can do more when I'm healthy.
Mm-hmm.
I can help more clearly when I have had breakfast and we're processing some challenges, and I'm trying
Mm-hmm.
to make my money last the rest of the month. I can
That's
do
right.
those things better when I am healthier about some things.
Sometimes I'm looking in the mirror, I have to give myself self-affirmation
Oh, absolutely.
that
Absolutely.
you are intelligent, you are smart. And I think sometimes, because of, history and stuff like that, sometimes African Americans have low self-esteem. That is something that, that we need to be mindful of, that we can overcome. We can do better. Just because things are hard, just because seems like we may not always make the mark, that sometimes, it's okay if I didn't make the mark today, but I'll do better tomorrow. Change our mindset.
That's wonderful. Absolutely. And when we're talking about health, I'm going to bring it back to something that I know many times I've heard individuals talk about. You have gone to the physician and you've talked to the physician, nurse practitioner, and you have a plan for care. And part of that plan for care includes taking your medications. And so many times with individuals, you take it in a haphazard kind of sort of way. If I think about it, I'll take my medicine. Those kinds of behaviors. I would encourage you to be very diligent about any kind of prescriptive therapies that are part of your care. If it means taking your medications around the clock, write it down if you need to, and put it in a pill case if you need to. But please be diligent about the plan of care that's being discussed. And that's why, again, communication is so important. If the medications are resulting in some side effects that you don't like, contact a healthcare
doctor.
provider. Don't just stop.
Right.
Because when we're dealing with individuals with high blood pressure, when we're dealing with individuals with thyroid problems, you cannot, if you're putting yourself in jeopardy to just stop taking the medicine. Contact your physician, contact that healthcare provider and say, I am having X side effects, I need to get in to see you. Now, I am not naive enough to know that may mean you have to stay on the line because that automated message that says we are having a higher influx of calls today, please, we'll get to your call as soon as possible. Believe me, I've been on that line and it takes a very, very long time. Okay, you're having a high influx of calls. That just means I've got to hang in there. Why? Because I need to have someone know that the medication that was prescribed for me is causing some side effects or is making me, I believe, sicker. So please, please do your diligence and don't ignore the plan of care that's been established for you. And if that plan of care does include medications and oral therapies of any kind, take your medications. Number 2, do not share your medicine with anybody else. If someone
not.
says, oh, I had something like that and, here, try this, please don't do that. Encourage that person to get into the physician, get into the care,
Get
to the
their own.
clinic so that we can give you that individualized, unique care that you deserve as an individual who is unique and precious. The plan of care is important, and your participation in the plan of care is important.
That's right.
Don't skip medicines, and if you skip, you can call, and if they say it's okay to double up, do that. But don't just practice medicine on your own.
Yes.
That's our job. Let us do our job because we want you to have optimal health.
In your time of being, training nurses and things like that, did you ever run across, what's the difference between holistic things like that? Because sometimes people want to quit taking the prescribed medications and go to this holistic stuff, and I'm going to try some tea, to help my ailments. What's your...
Yes, we have come across some of those strategies, and the point becomes this. Healthcare is a choice of the individual.
Yes.
What we know is that there are certain holistic slash, and please, I am not negative at all about that. So certain holistic slash organic practices that may indeed work for that individual. What we do have to recognize always is that the amount of the element is not regulated, so we can't really be sure that you're getting 5 milligrams of a particular element because there is no control over standards of there's no federal control over standards of quality. That's not my point. My point is, if that is indeed your choice, then I have to recognize that you have a choice in your care. But it is also my responsibility to share with you that fits into a full package of things that you can choose from. I recognize that in health care and in a plan of care, the individual is the center. The individual has the right to say, I really don't want to do anything. I have heard that if you, go to a particular place and you exercise, then your diabetes will go away. We can share the truth and the facts associated with diabetes mellitus, but the choice becomes that of the individual. We can share the truth and the facts about the plan of care with its strengths, with its challenges, and then the choice becomes that of the individual. An informed choice is the point that we want to make, and that's where that advocacy comes in. It's not that you have to agree with your healthcare provider, but our goal is that when you're making those choices, that you have an informed perspective, not one based on myths, not one based upon hearsay and he said, she said, none of those kinds of things, but an informed one.
So you mean, Mrs. Armmer, that if the doctor suggests that I got to get a flu shot or I got to get the vaccination, that I got to get it, I should get it?
I am
that it's my choice?
I'm suggesting that, number one, yes, it is your choice, but I'm also suggesting, more importantly, that you make an informed choice. If you can understand that based upon the data,
that's right.
We know that if you are going to get a particular, if you might get a particular vaccine, and that vaccine can, if it doesn't prevent you from getting the disease, it can certainly mitigate the strength and the problems that are associated with it. Those are the facts. Now the choice is yours because you can make and you have that choice. I think that is interesting that so many times we look at and we make decisions based upon emotions. We make decisions based upon some things that happened historically to African Americans. And believe me, there have been some horrors that have happened in terms of healthcare to African Americans. That was then, that is true. Now let's move forward in an informed way. So I don't ever think that we should discount or forget our history. I think that it is also important to have an informed decision when we are making our choice. And then once you made that choice, recognize what you cannot control are the consequences. You can make the choice, but you cannot control the consequences of that choice.
But we have found even with the vaccinations and even with the flu shots that it's not going to stop you from getting the flu. It's not going to stop you from getting COVID. And a matter of fact, you still have to take your precautions by, when these seasons come, wearing masks and things like that, right?
Absolutely, and I think that
Not being in big crowds, because
absolutely
we like to have big parties sometimes.
Absolutely,
and,
absolutely.
Sunday dinners.
Absolutely, and what I think is interesting is, and maybe it's a phenomenon of Americans, and not really. It's not racially based. It's
Right.
a phenomenon of Americans that we expect the silver bullet. And we
Yeah.
expect the bullet to do everything absolutely uniquely for 350 million people individually. And what we find out is that in healthcare, what we know is there is a uniqueness to each individual. And for some of the causative organisms, many of those organisms, especially viruses, can morph or change. So what we've got is a wonderful research base in the United States of America that can provide us with treatments, i.e. vaccines, that can give us I would call it a head start on any pathology that might come our way. No, we cannot say absolutely guaranteed you won't get it if you take the vaccine, but we can say that the vaccine is mitigating the challenges such that you don't have, if you test positive, the seriousness of it is going to be lessened and the likelihood of you filling a hospital bed may be reduced.
Now, what do you say to, one last question, what do you say to people who have religious beliefs? Because you know that there are some African American and just people in general, not just African American, who have religious beliefs about their health care.
You know what? I have religious beliefs about my health care. I think that each individual has the right to hold the beliefs that they choose. That's what we do in America. If your religious beliefs are indeed that you should not have certain medicines or transfusions or whatever that you hold as part of your beliefs, then in healthcare we honor that. And we recognize that that there are consequences, and we share the consequences, and then there are decisions that need to be made. There are going to be maybe some decisions that the individual may simply say, no, I do not believe that that will be what I want to do because I believe that in my faith we won't do that. I respect that. And that's what we have to do. I have a responsibility to share with you the consequences that may happen, the outcomes that may occur, and then the choice is yours. Recognizing that I may not agree with your choice, but I will respect your choice. And I think that becomes a difference. It may hurt me to recognize that your choice may take your journey down a pretty sad pathway. Nevertheless, if that's your choice, I will respect your choice. And the challenge becomes when an individual is making a particular choice, but their family members don't agree with it. And the family members want them to go in another direction.
Well, like hospice.
To go in another direction. Well, yeah, you've had that experience,
Yes.
So, but that becomes a piece that we have to recognize and care for as individuals. I know you had said that in our last few minutes, but I just want to mention one other thing because you brought it up.
Okay.
And I'm going to put a little bit of a label on it in terms of our African American health, and some of the things that you had talked about, even the playgrounds in the schools and stuff, and the things like that. What we are finding out and growing in our knowledge is the CDC identified a few years ago what we talk about as terms of social determinants of health. And when we're talking about social determinants of health, you know what? The neighborhood And the built environment is one of those categories. That's
Right.
exactly what you were
Exactly.
talking about when you're saying it looked like at one point our playgrounds were disappearing.
disappearing,
We know economic stability, we know education, healthcare and its access, as well as social and
Social economics.
community, all of that. All
Makes
of
a
those
difference.
factors make a difference, and those factors impact upon us as African Americans most extremely, most severely. And I'll do a commendation just for a moment to say that I am grateful that in the city of Peoria, we're in the process of exploring those kinds of challenges in terms of factors that can impact on our social determinants of health. It makes a difference if you live in an
does.
area that is considered a food desert,
Yeah.
where you have to travel so far. We're complaining at times about the
Yeah.
cost of eggs, and that's because you can drive to a grocery store. What happens if you can't even get to a grocery store without catching the bus and making 2 transfers? Social determinants of health are impacting on us as African Americans, are impacting upon our community, and I am grateful to say that in the city of Peoria and in this county, we are in the process. There is a process going on to explore those challenges to health especially of African Americans, but of health of all citizens.
The health department is doing a good job and working with our new mayor, Rita Ali, and trying to offset some of that and examine. They're doing a whole lot of studying and, critical thinking and everything else. So I think this is an awesome, exciting time right now for all this stuff. And I thank you again, Dr. Francesca Armmer, for coming on our show.
Thank you so much.
This concludes another series of Mother's War on Violence, and we thank you very much for listening.